Using medical student documentation for billing. Educational goal. Faculty, residents, and students will be aware of the requirements and procedures for using student documentation for billing. Learning objectives. Participants will be able to identify physical presence as a requirement for using student documentation for billing, describe situations that would meet the physical presence requirement, describe the procedure for attesting to physical presence in the note. CMS has modified their rules to allow the entirety of student notes to be used for billing. What's changed? A requirement called physical presence must be met. This is different from the requirements to use resident documentation. What hasn't changed? The attending physician must still personally perform the history, physical exam, and medical decision making and verify the accuracy of everything documented in the note. Physical presence means that any part of the student's note, other than review of systems, past medical history, family history, and social history, that is being used for billing must be performed in the physical presence of an attending physician or a resident. Physical presence requires the person attesting to it, attending or resident, and the student to be present together while information is being collected or verified with the patient. There are two different ways to achieve physical presence. The history and exam can be collected by the student while a resident or attending is present. This allows for direct observation of the student. The attending or resident can re-perform the history and exam with the student present. This allows for feedback to the student about the information they collected. When the student writes a note, they will identify either a resident or attending co-signer, depending on who will be attesting to the physical presence. If the resident attests the student's note, they will identify an attending co-signer. There are two attending attestation statements. One for the attending to verify accuracy of the note when the resident has already attested to physical presence. One for the attending to attest to both accuracy and physical presence. This does not allow students to be used as scribes. Students should be actively involved in the patients for whom they are documenting. When can this be utilized? Ambulatory and inpatient settings, initial notes, and subsequent notes. When can it not be utilized? PA or NP students, primary care exemption. We're going to take a look at 3 scenarios. For each scenario, does it meet the physical presence requirement? Scenario 1. A student and a resident see a patient together. The student performs the primary history and exam. The resident asks for a few additional questions and performs their own exam. The resident presents to the attending, and the attending evaluates the patient alone later. Does this meet the physical presence requirement? Yes. Physical presence is achieved with the resident during the initial evaluation. The attending can see the patient alone or with the student resident to verify the accuracy of the information. What happens next? The resident attests to their physical presence on the student's note. The attending attests to their involvement and the final accuracy of the note. Scenario 2. A student sees a patient alone and presents to the resident. The resident goes back with the student, and the resident verifies the history and exam. The student presents the patient to the attending. The resident goes with the attending to evaluate the patient. Does this meet the physical presence requirement? Yes. Physical presence is achieved when the resident goes back with the student to evaluate the patient. The attending can verify the information with or without the student present. What happens next? The resident attests to their physical presence on the student's note. Scenario 3. A student is working one-on-one with an attending. The student sees the patient alone and presents to the attending. The attending sees the patient alone and performs their own history and exam. Does this meet the physical presence requirement? No. The attending did not perform the history and exam with the student present. What happens next? The attending will provide their own documentation. To use the student's documentation, the student would need to come with the attending to see the patient. Thank you for watching this video and for all our efforts to teach our students.